Hello, this is Dr. Abulawi. The question my poster will answer today is if there's any difference in reaching goal vitamin D levels in blood when supplementing vitamin D in high weekly doses versus low daily doses. It's crucial to understand the importance of vitamin D and the consequences of having patients with vitamin D deficiency. It's commonly known that vitamin D is strongly associated with bone health, meaning if someone is vitamin D deficient, they're expected to have osteopenia and even osteoporosis down the road, which is very true. However, vitamin D is also associated with other conditions. Optimal vitamin D levels can help with maintaining good immune health system, good muscular system health, as well as good energy levels and stable mood. That being said, it's crucial to maintain vitamin D levels at goal. In the United States, the recommended goal is 30 nanogram per microliter. However, we see effects of vitamin D deficiency more clearly when vitamin D levels go below 20. For that reason, it's important to monitor and maintain vitamin D levels at goal. The articles reviewed in this poster were used from PubMed and Cochrane Library. I was able to identify 7 prospective, randomized, and observational studies, as well as a meta-analysis to further support the conclusion of this poster. I selected to view three studies in this poster, mainly because they had homogeneous design and aim. The first study took patients with vitamin D deficiency and broke them into two groups. The first one, they were given 50,000 international units daily for 10 days. The second group, they were given 3,000 and 1,000 daily for 2 months. This study found no statistical difference in achieving normalcy. The second study is actually closer in design to what we used for our patient population in Detroit, Michigan. So there were a group of patients were given vitamin D 50,000 weekly for 8 weeks, and the other group were given a lower dose at 2,000 daily for 2 months. The third group is similar to the second. However, the only difference is that vitamin D levels were checked again at 6 months. So the overall design for the 3 studies is that the patients with vitamin D deficiency would be supplemented with vitamin D different doses and frequency, and vitamin D levels would be checked every 2 weeks until 3 months, again, except for the last one that they were rechecked again at 6 months. That being said, if we look at the graph in the middle part of the poster, all of the patient populations that received different doses and frequencies of vitamin D reached the same target vitamin D at 3 months. They all were able to reach 30 nanogram per microliter vitamin D regardless of dosing and frequency, and that's the conclusion of this poster. Now, it's important to understand that when given high weekly or biweekly doses of vitamin D of 50,000 or above, the goal or the vitamin D levels were achieved faster in comparison to those who received lower doses. However, once again, they all reached the same target level at 3 months. Interestingly enough, in the third study, when vitamin D levels were checked again at 6 months, those who received lower daily doses maintained the vitamin D levels at target target numbers in comparison to those who received high weekly doses. This concludes my presentation. Thank you very much for listening and have a great day.